We are getting more personal than ever on today's show. Do you avoid travel or public places like movie theaters or public transportation because of pelvic floor dysfunction? Or you don't know what that is? You should stay with us. Welcome to Woman2Woman today, where we talk with inspiring women who are helping other women reach their goals and are changing traditional industries and roles in a very positive way. I'm your host, Jen Maceda, and on today's show, we are speaking with Dr. Angel Marie Johnson, urogynecologist and director of the Greater Boston Urology's Women's Health Center. Angel attended New York Medical College and completed her residency in obstetrics and gynecology at Albert Einstein Medical College, Montefiore Medical Center in the Bronx. Following her residency, she came to Boston for a 3-year fellowship program in urogynecology at Mass General Hospital. Angel is also a speaker at this year's 2018 Metro West Conference for Women on September 19th and 20th. Thanks for being with us.
Thank you.
So that was a very, very long and detailed intro because you have done some amazing work to prepare yourself for urogynecology. I can't even say it right. Tell us what that is.
So urogynecology is essentially the marriage between urology and gynecology. So I specialize in pelvic floor dysfunction, which essentially is voiding dysfunction when your bladder is not functioning to the best of its ability, bowel dysfunction, or pelvic health.
So tell us your path to this, because when you were a little girl, did you say, I want to be a urogynecologist?
Absolutely not. I said I want to be an astronaut.
That's awesome. All right, how did you deviate from that path? Where did you start?
So I always loved science, and I thought, wouldn't it be cool to be amongst the stars? And so I wanted to be an astronaut, and I wanted to fly the shuttle. But at the time, when I looked into it, I realized that women, there weren't as many pilots, and you had to fly really big planes and be in the military, and it just wasn't the route I wanted to take. So in my family, a lot of the men were doctors and the women were nurses. Didn't like that route either. So instead I decided I wanted to be a doctor. Now, initially I thought I wanted to be a pediatrician because as a kid, that's the coolest doctor you know, and you interact with your pediatrician, their office is fun, they have toys, who wouldn't want to be a pediatrician? But during my training, I realized that wasn't the side that I wanted to represent. Instead, I wanted to actually advocate for women. Initially, when I went into obstetrics and gynecology, I wanted to advocate for the underserved, represent women who couldn't, like they were silent, didn't have a voice to represent themselves. And I actually thought I would go into high-risk OB. I started residency as kind of an eager freshman, or intern rather, and early on in my residency, I encountered kind of that patient that changed your perspective, that person that puts you on a different route, and it was someone who had voiding dysfunction. She came in, she spoke to my mentor, again, I'm the intern, kind of, barely in the room, not even taking up my own space, kind of, almost behind the door during this encounter. She breaks down in tears. She talks about how she just isn't living the life she envisioned. She doesn't go visit her grandchildren because she's afraid to get on a plane. She doesn't want to have an accident and then have to explain herself. She actually showed us kind of her emergency bag where she had a change of clothes and could almost essentially take a shower wherever she was, God forbid something happened. And just with kind of minimal, tips and tricks and very kind of low invasive options, my mentor was able to change her life.
Wow.
And so that's when I realized that's what I wanted to do, and that's what kind of brought me to urogynecology.
Yeah. Was it an easy path?
No, it never is in medicine. Again, part of my goal is I wanted to be a trailblazer. And, it's easy to kind of just get in line and follow, in the footsteps of the person in front of you. It's never easy to kind of blaze your own trail and be unique and again, open that door and step on that, that soapbox and have that microphone. And so definitely had to overcome some challenges to get here. And now that I've kind of reached, or at least finished training, now it's up to me to kind of look behind and help elevate those behind me, help motivate people coming through the pike now.
Absolutely. Yeah, that's all of our responsibilities for sure. What did you say to yourself as you were going through? And, medicine, we were talking a bit off camera, it has changed quite a bit in that there are more women that are entering the medical field, are becoming physicians. What are some of the things that kept you on that path that you would share with others to say, if you think this to yourself, this will get you through?
So for me, I grew up as an only child in a single-parent household with a really strong maternal figure, and my mother told me that I could do whatever I wanted to do as long as I worked hard enough. And so in my mind, that's always kind of, what I told myself and again, just try harder, keep at it, don't give up, you can get wherever you want to be. Yeah. And it served me well. And my daughter, who's 4 years old, I tell her the same thing. You may not like it, but finish it.
Yeah.
Then we can do something else.
That's right. That's right. That goes for music lessons and
absolutely.
Right?
She just started soccer, so we'll see how that goes.
Soccer, yes, absolutely. Well, you're teaching that foundation of hard work gets you where you want to be.
Yeah, and perseverance.
Most of the time.
Absolutely.
Yes.
Most of the time. There's always exceptions.
Yeah. Well, you had a propensity and still do to math and science, so that really medicine kind of brought those two together.
Yeah, so really it was my interest in math and science, and then I always had this kind of deep need to help people and to really kind of be that voice and to advocate for people, and that's medicine. I do that every day. When I see a patient in the office, I tell them, I'm your bladder cheerleader.
I love it.
We'll work together to get you where you want to be.
Yeah.
Just be patient. It may take some time, but we'll get there.
Yeah.
And so medicine for me was that natural marriage.
Yeah.
And so it helped me kind of through the course.
And something that is really surprising to me that you shared with me is the age of people that are coming in for your support and your help. Tell us a bit about your clientele or your patient.
Sure. So right now, my practice ranges in age from 14 to 101. And so there definitely is kind of the breadth and depth to the patients I see. But as a gynecologist, I see adults primarily. But really, if you have voiding dysfunction, it can happen at any age. It usually looks different depending on the patient's age. So for 30 and 40-year-olds, I tend to see women who have what's called stress incontinence. So they leak urine with activity. So they sudden cough, laugh, sneeze, they may have an accident. They do a jumping jack at the gym, jump on a trampoline at the trampoline park, they might have an accident. So that tends to be the story around 30 to 40-year-old women. And it tends to be the result of childbirth.
Okay.
And weakness of our pelvic structures and our pelvic muscles.
Sure.
Now, as women age, they tend to develop what's called overactive bladder. And that brings to mind that old commercial of the I gotta go right now. So it's that sudden urge to go to the bathroom.
Okay.
Well, you'll stop what you're doing. You'll pull over on the side of the road. It's an emergency. You're going to the bathroom more often. We all have those friends who you're like, you're going to the bathroom again?
Right. Yeah.
You just sat down.
Right.
So that, and then getting up at night. There's some women that get up every 2 hours at night to go to the bathroom.
Wow.
Yeah, and that's not normal.
No, that's not a good.
At any age.
Right.
Yeah.
At any age. Yeah. So you talk about normalcy, and we've had a couple of shows where people have said, we don't prioritize ourselves, and we don't really care about normalcy because we're thinking that it's an aging issue. But you're saying 30 to 40-year-olds, is it because they have children and so it completely changes their pelvic floor? But you also said a stress reason. So tell me a bit about that.
Sure. So your first question, I definitely agree with you that for women, we wear so many different hats. We can be wife, mother, daughter, sister, friend. And so within those roles, and even traditional female roles, we tend to be the caregivers. And so we tend to prioritize everyone above ourselves. All day, every day.
That's right.
And so usually when I see a patient, the first thing they say is, why did I wait so long? And so that's a big thing that we need to focus on. And as women, is to prioritize ourselves, take care of ourselves. When our basic needs are met, then we can better serve everyone else.
You know what it makes me think of? All these, you mentioned the commercial, I gotta go right now.
Sure.
And so that kind of normalized urinating in our underwear, which then normalized putting a pad in your underwear at a certain age. I told you guys that we were gonna be getting really personal. But that, no, I'm not saying me, but at some point, yes, probably, right? But that's not normal. Yeah, possibly. I'll say it that way. That's not normal, but yet all of society is shoving products in our face and telling us that that is normal. So how do you even get people to come to you?
So the first thing I like to tell people is it's not normal to have accidents outside of potty training at any age.
I love that.
Okay, it's not normal. Is it common? Yes.
Yes.
And so that's the difference. When you talk about normal, what is normal, right? Just a set of guidelines that we agreed to. But yes, it's common, but my thing is, and I tell patients this too, and I'll tell you this as well, Jen, that if it bothers you, if it's impacting your happiness, if it's causing you to change your decision making, your activities, your outlook on your life, then it bothers me. That means that now we need to intervene and we need to change. If it doesn't bother you, it doesn't bother me. These conditions aren't life-threatening. They're not a quantity of life issue, but they're a quality of life issue. And that's what makes them important. Now, your other question about how do patients, what brings patients to me? Usually it's their primary care physician. And so during their well-woman visit or during their annual visit, they'll mention other medical conditions that they have. And then usually the last thing they'll say is their bladder function. And then the one thing they might say as they walk out the door is, oh, I have accidents of stool too. And that's the part that no one mentions.
Right.
It's just as common as bladder dysfunction
Really?
as bowel dysfunction.
Oh, I did not know that. Something
Absolutely.
else too. Watch.
Something else to
Wait
look forward to.
That's what I
right?
was going to say that, but no, I don't have to look forward to it.
No,
because you're in
don't.
my life.
Absolutely. These are all conditions that
Yeah.
are treatable. And
Right.
sometimes it's as simple as a diet change, an activity. There's the number one treatment for all of these conditions is behavioral modification.
Really?
It is.
Well, tell us about that. What is?
Sure. So when it comes to your bladder,
Yeah.
there's certain things that we eat and fluids that we drink that are bladder irritants. Okay. The big three that I tell everyone about is caffeine. So
Oh, no.
I know. So coffee.
Yeah.
Caffeine is a diuretic.
Okay.
Even if you don't have the tendency to have accidents of urine, what does coffee make us do? We empty our bladder, we empty our bowels. That's what it does.
Yep.
If you already have a tendency to leak or to have that sudden urgency, it makes it that much worse. Okay, so I tell people to limit their caffeine.
Okay, don't tell us another one.
Okay.
We are going to take a quick break, and when we come back, Dr. Johnson is going to share with us other strategies so we can change our behavior and live a better life. So stay with us. And we're back with Dr. Angel Marie Johnson, and we are talking about some really private and personal issues that women are typically facing but don't have to face. So I'm glad you're back with us. All right, Angel, tell us the scoop on what is going to happen. Maybe not, I was going to say later on in our lives, but it's not necessarily an age thing.
It's
right?
not, no.
So when we went out to break, you were telling us there are some things that we should avoid, behavioral modifications that are pretty easy to abide by. One of them was caffeine. Give us something else that can really change our lives.
Okay, so well-known bladder irritants, so caffeine. The next is tea.
Tea.
So even herbal tea can irritate your bladder. And the reason why is because it's acidic. And so the acid can cause your bladder to spasm, sending you running to the restroom. Now, the next one that's really common right now is seltzer, so carbonated water.
Yeah.
And so essentially it's that carbonation that is the bladder irritant. And so right now, companies are selling more carbonated water than even soda.
I believe it.
Yeah, so it's one of the first time in history that that's been the case.
Yeah.
I hear that, and other Eurogynes hear that,
Yeah.
and it strikes fear in our heart because now we know that there's more women
Yeah.
who are going to manifest these symptoms and may not seek treatment because of it.
Let me ask you, is it the same for men?
So it can be. Usually the causes of these symptoms are different. So for women, especially overactive bladder, it tends to run in families. So there tends to be kind of a genetic predisposition. So if your mother used the bathroom often, you might, your daughter might, or your sister might.
Because behaviors are the same. I mean, you're kind of teaching your child how to act and what to eat, and it's maybe a cultural food intake. Like there's some dynamic that happens in your family that passes on from generation to generation.
So absolutely. It could be that behavioral mirroring or modeling or emulating. It also can be a genetic component, meaning that the way that your bladder has formed, the structural component of your bladder, the way that your nerves work are slightly different, and they predispose you to going to the bathroom often. That part we don't know yet. There's a lot of different studies that are out there and a lot of different scientists that are working on it. But that's what we think, and that's what we see, is that in families, it's very common. And even in my own patient population or my own practice, I see it. I'll see the mother and the daughter and the sister and the friend.
Wow.
And you see it that way.
Yeah, they just pass your card down.
Absolutely, and please do. Please do.
Yeah,
because
exactly.
again, my goal is just to provide access.
Right.
You know,
Right.
and I urge any woman and every woman that if you have these symptoms and it is bothering you, to see someone.
Yeah.
You know, I would love
Talk
to
to
have them
someone
see
about
me.
Sure.
But
Talk to
someone
about it. Yeah.
Because we can help.
And it's not just urine.
It's not.
No.
So the condition that no one talks about, even in my office, I have to kind of pull out of patients, is what's called accidental bowel leakage or fecal incontinence. So it's the leakage of stool. It tends to be liquid stool because that's harder to control. But even form stool, you can have accidents.
Really?
Yes. Usually it starts with you just notice some staining on your undergarments, and then it can progress to, you know, it can progress and increase in quantity of the stool that's kind of leaks out without your awareness.
And why is this happening?
So it's all kind of tied into the same risk factors. So the biggest one is childbirth, especially if you have a complicated delivery or you require some kind of assistant with a vacuum of forceps, if there was any kind of lacerations, that whole kind of constellation causes injury to your pelvic floor or your pelvic muscles. Now you need these pelvic muscles to control your bladder function, to allow for appropriate vaginal health, and to control your bowel function. Because the way that the pelvis, especially the female pelvis, is structured is there's a basket of muscles, and that elevates everything. And if you have an injury to those muscles, then it predisposes you to pelvic floor dysfunction.
Okay.
There's other things that can happen in your life too. If you're at a job where you do a lot of heavy lifting. I recently had a patient in the winter who shovels snow. And so a lot of that increased intra-abdominal pressure has led to muscle injury. And so then they can have prolapse. If you have a history of constipation and you have to strain and push to empty, that can cause injury. And also family history.
Yeah. It all makes sense. Is there a dietary behavior modification for fecal leakage as well as?
Absolutely.
Okay.
So when it comes to the bowel side, you know, the other side of the coin, I talk a lot about fiber. And more so than just eating a diet rich in fiber, with green leafy vegetables, fortified foods, I actually recommend a fiber supplement.
Okay.
Because it's really hard to eat enough fiber to really reach the quantity that you need to regulate your bowels.
Okay.
And what fiber does is it's almost like that Goldilocks medication, where if your stools are too loose or too hard, it kind of shifts you to the middle.
Okay.
Where it's a soft inconsistency, you're able to control it, and you're able to empty completely.
Yeah. Again, you've changed my life. And my family's life, I'll put it that way.
Yeah. Well, when it comes to both constipation and fecal incontinence, that's not something you'd wish on your worst enemy.
No, of course not. But again, you know, back to that feeling like that's just normal aging, and there's nothing that I can do. You talked about muscle injury, but muscle atrophy too.
Absolutely.
I've heard like doing your Kegel exercises, and those are all strengthening the muscle floor, your pelvic floor. Is that right?
Absolutely. So Kegels.
Thank you.
It's okay.
Yeah.
Every day.
yeah.
So Kegels, named after Dr. Kegel.
Okay.
It's actually a specific exercise where you tighten your pelvic core muscles. And just like you would do a bicep curl, it helps strengthen the muscles.
Okay.
The problem with Kegels is it's hard to learn how to do them, both efficiently and effectively, right? We don't grow up learning how to tighten our pelvic muscles.
No.
And so usually it takes either a physician to show an individual how to do a true Kegel, and then you exercise kind of on your own time, or we actually have certified pelvic floor physical therapists, where they're physical therapists that have undergone additional training to treat and manage conditions of the pelvic floor. So bladder dysfunction, bowel dysfunction, vaginal health.
Yeah.
And they can guide an individual, both men and women, on how to strengthen those pelvic floors.
Because I mean, it would be good to have somebody tell you that you're doing it right.
Correct.
But if you are watching this, can you, and you don't have somebody to tell you to do it right, can you just stop yourself from urinating and going to the bathroom? And is that almost, like I'm doing it right now. I just find myself like, you wanted to know that. I doubt
No. The joke in my office is that my office staff, every time we talk about Kegels, we do Kegels. And I tell women, nobody knows.
Yeah, nobody knows you're doing it. Yeah.
Get in your exercise.
Your Kegel face.
Absolutely. Get your exercise in for your pelvic health.
That's right. So, the reason why I know about Kegels is because it's talked about quite a bit after a woman has a baby through her vaginal wall. She's not having it through her vaginal wall.
No,
through her vaginal canal.
Yeah, vaginal delivery.
Thank you very much. That it is helpful to strengthen that part of her body. So, I'm doing it for sexual health, but essentially it's for incontinence as well.
It helps everything. So you started to say how you do a Kegel, and that's how I describe it.
Yeah.
So for women who don't know, am I doing it right, doctor?
Right.
I kind of forgot what you told me in the office. I tell people, when you're emptying your bladder, try to stop the stream. That's a Kegel. And so once you do that, once you engage that pelvic floor, kind of create that mental note, and then I tell women, to do a set of Kegels, and usually you hold it for 2 seconds at a time and do a set of 10. And I say to do it when you're driving to and from work. Because it's one of those exercises that if you don't do it, it doesn't work.
Right.
So find a time in your day that you do it every day.
Right.
Where you can get your 2 reps in or your 2 sets in.
Yeah.
And do it that way.
2 sets of 10.
Absolutely.
Just like you would a bicep curl.
Exactly.
Why not? That's right.
Same idea.
Yeah.
Very similar muscle.
Yeah.
Just not thought about.
Right.
The other thing that I say is, let's say you don't have a bladder dysfunction. You don't have that urgency, but you're in a situation where you really have to empty your bladder and maybe you can't. I always use the example of you're at a concert. You're not going to get up to the very last minute.
Right.
You get up, now there's a line.
Yeah.
Right? So I tell women, when you're in line, do your Kegels. Because what happens through your neural pathway, it sends a signal to your bladder to relax.
Okay.
So your bladder's kind of resting state is to just relax, to be a reservoir that just fills and holds. And it's not until it gets to a certain stretch point are you even aware of it.
Right.
And it gives you those signals to empty. So again, you're waiting in line, do your Kegels. It'll give you more time, more control, decrease your anxiety so you can get to the restroom.
That is brilliant.
Yeah.
You have helped so many people today, I'm telling you. Thanks for talking about personal things, because we just don't talk about it, and we should. And we shouldn't live with things that change the choices that we make and our lifestyle. Like you stop traveling because you might have incontinence and it's just cumbersome and it's really embarrassing, and you don't have to live like that.
You do not. We can help.
We can help.
Come and see me. I'll help you. I'll be your bladder cheerleader.
There you go. I love that. We're gonna put that as your tagline underneath your picture on the show. Okay. Thank you for being here today. This was really informative for all of us, and thank you for what you do for women, because I can tell it's not just a job; it's a real passion for you. So
absolutely. Thank you.
Yeah. Thanks for sharing it with us. Thanks, everybody. And please remember to follow, like, and subscribe to Woman2Woman today on Twitter, Instagram, Facebook, and YouTube so you don't miss a show. Thanks to the entire team at Access Framingham, especially Shavarsh Morrissey. Thanks also to Jess Friswell, our assistant producer. I'm Jen Maceda, your host of Woman2Woman today. Thanks for watching, everyone, and we'll see you next time, where we hope to inspire you.